forming clots in the walls of damaged vessels while maintaining the blood in a fluid state within the vascular system is called as hemostasis. It occurs in three stages. The first stage is vasoconstriction, second stage is platelet plug formation, and third stage is coagulation of the blood, that is conversion of platelet plug into the definitive hemostatic clot. These are the three stages occurs when there is any injury to the wall. First one is vasoconstriction, second one is temporary hemostatic platelet plug formation, and third one is definitive hemostatic clot. And vasoconstriction occurs because of the mechanical injury as well as the release of serotonin and other vasoconstriction. And the temporary hemostatic plug occurs because of the when the collagen is exposed and platelets are redirected to the damaged vessels by von Willebrand factor, and there will be release of ADP and thromboxane A2, which activate more number of platelets and which causes aggregation and further adhesion of platelets to the with each other. And then the damaged vessel wall also, it is going to initiate the activation of coagulation through the intrinsic pathway, whereas release of thromboplastins, it activates the coagulation system by activating the extrinsic mechanism where they form the fibrin mesh network, which will be able to form definitive hemostatic plug. Mechanism of hemostasis, vasoconstriction. Following an injury, the first event that takes place in hemostatic mechanism is vasoconstriction. Vasoconstriction occurs due to the local myogenic spasm and vasoconstrictor agents released by the traumatized tissues and platelets and nervous reflexes. Platelet plug formation. When blood vessel is injured, platelets adhere to the exposed collagen and von Willebrand factor. Binding produces platelet activation, which releases the contents of their granules. The released ADP acts on ADP receptors in the platelet membranes to produce further accumulation of more platelets, so which is called as platelet aggregation. Aggregation also facilitated by the platelet activating factors, which are secreted by neutrophils, monocytes, and platelets. Platelet aggregation causes the production of arachidonic acid derivatives like thromboxane A2 and prostacyclin. Thromboxane A2 further increases platelet aggregation and helps in the formation of the temporary hemostatic plug. Thromboxane A2 causes release of norepinephrine and serotonin, that is 5-HT, which are vasoconstrictor agents. Prostacyclin inhibits thromboxane A2 and prevents further platelet aggregation, and which is going to keep the function of the platelet plug to the local tissue where there is an injury. Administration of aspirin in low dosage shifts the balance towards the prostacyclin by inhibiting the thromboxane A2 and inhibits the platelet aggregation. So thus the aspirin in low doses prevents myocardial infarction and stroke. Those are vascular accidents. Coagulation of the blood. It is a physiochemical change by which the liquid blood is converted into jelly-like mass called clot. Substances necessary for clotting are called clotting factors. The process of coagulation or clotting of the blood occurs in three stages. The first stage is formation of the prothrombin activator, second stage is conversion of prothrombin into thrombin, and third stage is conversion of fibrinogen into fibrin. These are the circulating coagulating factors to name. By the Roman numericals, they have been given classified into 13 clotting factors. Factor 1 is fibrinogen, 2 is prothrombin, 3 is thromboplastin, 4 is calcium, 5 is proaxelerin, 7 is proconvertin, 8 is antihemophilic factor, 9 is a plasma thromboplastic component or also called as Christmas factor, 10 is Stewart power factor, 11th is plasma thromboplastin antecedent, 12th is Hegman factor, and 13 is fibrin stabilizing factor. The prothrombin activator is formed by two ways. One is intrinsic pathway. Intrinsic pathway is triggered when blood is exposed to the subendothelial collagen tissue, resulting in the formation of intrinsic prothrombin activator. It occurs when there is a trauma to the blood vessels. It occurs in vivo, that is inside in the body, and in vitro in the test tube. The factor 12 comes in contact with the subendothelial collagen tissue and is converted to activated factor 12. And this reaction is catalyzed by high molecular weight kininogen and kallikrein. The active factor 12 then activates the factor 11 and active factor 9. Active factor 11 activates the factor 9. The factor 8 is activated when it is separated from von Willebrand factor. Now activated factors 9 and 8 along with phospholipids, calcium activates factor 10. In the presence of tissue phospholipids, calcium and factor 5 activated factor 10 catalyzes the conversion of prothrombin into thrombin. Note activated 10 plus activated 5 plus platelet phospholipid together form prothrombin activator. Extrinsic pathway, injury to the extravascular tissue and blood vessel causes release of substance called tissue thromboplastin, which is a complex of phospholipid and protein. It is released from the injured tissue, which activates the factor 7 to activated factor 7. It occurs in vivo only, inside the body only. The tissue thromboplastin and factor 7 activates factor 9 and 10. Ultimately, activated factor 10 catalyzes the conversion of prothrombin to thrombin in presence of tissue phospholipids, calcium, and activated factor 5. The last part of the pathway, that is from the activated factor 10 onwards, is a common for both. Conversion of fibrinogen into fibrin. Now thrombin converts fibrinogen into fibrin monomer. Fibrin monomer then polymerizes to form loosely arranged strands of fibrin, that is a soft soluble clot. Later, loose strands are modified into dense and tight aggregate, that is insoluble and elastic fibrin clot, and later the later reaction is catalyzed by the activated factor 13 and calcium. So this is the chart which is showing intrinsic mechanism and extrinsic mechanism of coagulation. When the collagen is subendothelial collagen is exposed, the factor 12 gets activated under the influence of high molecular weight kininogen and kallikrein. Then it is going to activate the factor 11. The activated factor 11 converts inactivated factor 9 into activated 9, and then the factor 8 is released by the von Willebrand factor. That is going to activated 8 is going to help in the conversion of the inactive 10 into active 10 factor, and activated 5 factor calcium is going to form the prothrombin converting enzyme, which is going to convert prothrombin into thrombin. Whereas in extrinsic system, there will be release of a tissue thromboplastin, that is factor 3, which is going to convert the inactive factor 7 into active factor 7. And this factor 7 is going to convert inactive 9 factor into active 9. Sometimes it is going to also help in the conversion of inactive 9 into active 9 as well. All these reactions, they involve they require calcium, except for the first two reactions of intrinsic mechanism. Otherwise, the rest of all the coagulation reaction, they require calcium. So in the next step, the fibrinogen gets converted into fibrin in the presence of thrombin, and these fibrin threads, the monomers, they get polymerized. They will be stabilized by the active factor 13, and which is they're going to form the meshwork of the fibrin threads, and ultimately forms the the, the firm secondary plated plug. These are some of the actions of thrombin. Thrombin helps in the conversion of inactive factor 5 into active factor 5, then 8, as well as 13. Whereas the active factor 5, it further helps in the conversion of the prothrombin into thrombin, so thus it acts as a positive feedback mechanism for the formation of or more generation of the thrombin. The thrombin has other effects as well. It acts as a fibrinolytic system where it is going to convert inactivated protein C into activated protein C, which is a potent potent fibrinolytic or potent anticoagulant.